How's it going, guys? Past level question for Hematology Step 1 Internal Medicine 2CK. 7-year-old boy injures his knee while playing soccer. Arthrocentesis positive for blood. This is a hemarthrosis. Okay, so even without this sentence here telling you the maternal uncle died in childhood from mild head trauma, you should know instantaneously that a school-aged boy with hemarthrosis is hemophilia A or B till proven otherwise. If you had to guess in a vacuum, A, factor 8 deficiency is way more common than B, factor 9 deficiency. And just obviously X-linked recessive, okay? But USMLE will give you this pass level vignette sometimes, all right? So impairment of which of the following most likely responsible? Choice A, antibodies against clotting factor, wrong fucking answer. Now, some of you will be aware that antibodies against factors 8 or 9, that is a possible mechanism for hemophilia A/B respectively. It is. It's exceedingly rare as a primary cause. It tends to be patients who are treated with factor 8 or 9 aliquots over time for their hemophilia deficiency in the clotting factor, and then the immune system develops antibodies against. So, for example, they'll tell you that there's an increase in PTT. You need to know hemophilia is an isolated increase in partial thromboplastin time. PT bleeding time are normal. And they'll say, despite repeated aliquots of factor 8, the PTT remains elevated. And the answer would be check antibodies against factor 8. Okay, it's not hard, but that's how patients can develop choice A in this setting. Wrong fucking answer. Choice B, clotting factor synthesis, correct answer. As I said, not dramatic, it's pass level. So hemophilia A, it's an inability to synthesize factor 8. Hemophilia B, inability to synthesize factor 9. So let's just hop through the others here. Choice C, gamma carboxylation, clotting factors, wrong fucking answer, vitamin K deficiency. So necessary for the activation, clotting factors 2, 7, 9, 10, as well as anti-clotting proteins CNS. And for vitamin K deficiency, the 3 vignettes on USMLE are going to be a neonate with bleeding from the umbilical stump. Number 2 is going to be patient who's been on broad spectrum antibiotics for many weeks, e.g. for endocarditis, where it's killed off the normal bowel flora, and they can say that there's a decreased dose of warfarin required, because if you have decreased vitamin K, then which antagonizes warfarin, then you need a decreased dose of warfarin. And the 3rd vignette will be a patient who had rat poisoning, who was exposed to rat poison, okay? Because rat poison has a warfarin-like effect. So you'll get an increase in PT and PTT with normal bleeding time for vitamin K deficiency. Wrong fucking answer. Choice D. Actually, I should just mention vitamin K is a cofactor for an enzyme called gamma glutamyl carboxylase, okay? Don't confuse that with warfarin, which inhibits vitamin K epoxide reductase, which is merely an enzyme that helps recycle vitamin K to its active form. As I already said, wrong fucking answer. Choice D, platelet adhesion, wrong fucking answer. So this is platelets sticking to endothelium, okay? So this would be von Willebrand disease. This could also be very obscure things like Bernard Solier, holy shit. But 19 times out of 20, not even, I'd say 29 times out of 30, because Bernard Solier and Glanzmann non-existent in USMLE, truthfully. But this is going to be von Willebrand factor, which is going to bind glycoprotein 1b on the platelet to vascular endothelium / underlying collagen. And long discussion is von Willebrand disease, being that it's autosomal dominance. You're going to have usually a teenage girl, obviously can be a male, but they reward you knowing inheritance patterns. So if you know that hemophilia is A and B are X-linked recessive, you can eliminate those as answers if they give you a teenage girl, for instance. One clotting factor problem, one platelet problem for the vignette for von Willebrand disease. Long fucking discussion, wrong fucking answer. Choice C, platelet aggregation, wrong fucking answer. So this would be ITP, okay? 39 out of 40 times, where Glanzmann thrombasthenia could be the other cause. So ITP is going to be viral infection. Only 50% of patient vignettes will mention the viral infection. Usually school-age kid, 4 out of 5 times. 1 out of 5 vignettes will be a woman 30s to 40s, and they're just going to give you random bruising in the woman 30s to 40s. And the kid, it's the viral infection with petechiae, nosebleeds, easy bruising, okay? And you just have to know straight up that's ITP, and you're going to have an increase in bleeding time. PT, PTT are normal. So treat with steroids, followed by IVIG, followed by splenectomy. Lengthy discussion, wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe to my channel. Appreciate your time. That's it.